Daniel Clark. I'm a physical therapist assistant, and this is my presentation on blood flow restriction therapy, or BFRT. The purpose of this presentation is to inform those in the origins, effects of BFRT on the muscles, how it can be used to benefit the elderly, as well as contraindications and some adverse reactions to the treatment. I will show the effects of BFRT when used with the elderly population that will help improve strength in patients with generalized weakness due to various conditions. While attending a funeral and being seated in a seiza position for an extended period of time, Yoshiaki Sato realized that the swelling in his calves was similar to how his legs felt when he did weight training with his lower extremities. It led to an important question and theory. He stated, "I wondered whether purposefully constricting blood flow could artificially replicate the physiological conditions of hard training. And if this were true, could benefits be realized by only lifting light loads instead of heavy weights?" The moment of proof came in 1973 at the age of 25 while Sato was skiing. During that ski trip, he fractured his ankle and damaged the ligaments around his knee. Following diagnosis, the doctors told Sato it would take at least 6 months to heal. With a plaster cast on, Sato rehabilitated himself using bands applied to his upper leg. He repeatedly applied pressure on and off while doing isometric exercises for 30 seconds at a time, with a few seconds off between reps 3 times per day. The results of his regimen shocked his doctor when the muscles did not atrophy and he fully recovered within 6 weeks. What is BFRT and what does it do? The object of BFRT is to restrict the venous return from the extremities by approximately 40 to 80%, while arterial blood flow is allowed to remain unobstructed. This allows blood to pool in the extremities and musculature. This overflow of blood in the limb replicates high-intensity resistance exercises, which stimulates muscle protein synthesis on the cellular level. This creates a metabolic overload, signaling the pituitary gland to release human growth hormone, which causes growth of muscle, bone, and nearly every cell in the body, as well as enhancing fat loss. The dominant device on the market right now was developed by Delphi Medical, a company that has been the worldwide leader in tourniquet technology for over 35 years. Their tourniquets are used in over 20,000 surgical procedures a day. Delphi, along with Owens Recovery Science, developed the personalized tourniquet system for blood flow restriction. This is an FDA-regulated tourniquet with multiple safety features to allow for the safest use of BFRT. It includes advanced pressure regulation, reperfusion timer for BFR to prevent reinflation, to ensure adequate time between cycles, Doppler sensors within the cuff to ensure that the proper pressure is maintained, as well as safety alarms to warn of over and under pressurization of the cuff. Effects of BFRT on the musculature of an extremity. The physiological process is as follows. Slow twitch muscle fibers are activated soon after BFRT begins. When venous blood flow is modified, oxygen, which slow twitch muscles need to function, runs short in the early stages of BFRT. This condition created by BFRT is equivalent to exercise with a heavy load. Fast twitch muscle fibers start to activate under this condition even if there is not a heavy load being used. This leads to a simultaneous stress on both the slow twitch and fast twitch muscles because the slow twitch muscles do not receive sufficient oxygen. When all of the multiple working muscles are fatigued in early stages, lactic acid is produced in a large volume. Lactic acid stimulates receptors in the muscles that results in signals being sent to the pituitary gland that subsequently results in the secretion of a significant amount of growth hormone. What does this mean for rehabilitation? Because the type 1 slow twitch muscles become exhausted rapidly due to the hypoxic conditions created by BFR, It allows the type 2 fast twitch muscles to engage much quicker during the activity. The activation of the type 2 muscles generates high levels of lactate, which the body cannot clear out of the system fast enough. Because the activation of type 2 muscles happens so quickly, the amount of resistance required to improve strength is much, much lower. Mostly often, only 20 to 30% of a patient's 1 rep max is required to achieve improvements as opposed to using 65+% of a 1 rep max. This is very important when rehabilitating those who cannot lift large amounts of weight, such as the elderly, because BFR tricks the body into thinking it has performed an extensive, high-intensity workout. However, there is minimal cytoskeletal matrix damage, which means exercises can be completed daily. As a result of daily resistive exercise, hypertrophy and strength gains can be seen as early as 2 to 3 weeks. The purpose of this presentation is to discover if, in elderly patients with generalized weakness, will BFRT combined with exercise show greater improvement in lower extremity MMT scores than with exercise alone. To answer that question, 2 separate systematic reviews were referenced that discuss the use of BFR with the elderly population. The first review, titled Effects of Blood Flow Restriction Training on Muscular Strength and Hypertrophy in Older Adults, reviewed over 2,500 articles and 11 studies. The overall findings of the review revealed that both during low-load training and walking, the addition of BFR elicits significantly greater improvements in muscular strength. They concluded that low-load BFR and walking with BFR is an effective interventional approach to stimulate muscle hypertrophy and strength gains in older populations. The second piece of literature used to confirm the question is titled, Does blood flow restriction therapy in patients older than 50 result in muscle hypertrophy, increased strength, or greater muscle function? Those reviewing found 30 articles that included sample ranges from 6 to 56 participants. Exercises included walking, resistance, training with machines, free weights, body weight, elastic bands, and water-based activities. The retained articles included healthy participants, those with CVD, OA, osteoporosis, sporadic inclusion body myositis, and those with spinal cord injuries. Their findings show muscle hypertrophy, as measured by cross-sectional area, thickness, volume, mass, and/or circumference, greatly increased. They concluded that BFR may demonstrate utility in aiding rehabilitation efforts in adults older than 50 years of age, especially for inducing muscle hypertrophy, combating muscle atrophy, increasing muscle strength, and improving muscle function. BFRT in the elderly. Because BFR requires the use of much less resistance to achieve strength gains and muscle hypertrophy, it can be used on a very wide variety of patients with various diagnoses. Patients suffering from Parkinson's, strokes, OA, RA, osteoporosis, post-surgical rehabilitation, and any other issues that may lead to prolonged immobilization and deconditioning. Improving strength in the extremities, especially the lower limbs, also leads to improved balance and agility. As the weight required by BFR is much lighter than that of traditional training, the lower load greatly reduces stress on the joints, requires less torque to move the resistance, reduction in delayed onset muscle soreness, little to no muscle protein breakdown, meaning exercises can be performed daily, and it reduces blood pressure secondary to less work required to perform the exercise. As with all interventions in the field of physical therapy, there are some precautions and contraindications that will need to be discussed when deciding if a patient is an acceptable candidate for BFRT. Those contraindications are listed here on the slide. When using BFR with elderly patients, the same contraindications still need to be observed, but you must also consider some precautions before use. Elderly have more fragile and thinner skin than those in the younger population. The use of the BFR tourniquet can cause shearing of the skin and lead to wounds and infection. Patients using blood thinners can display severe bruising in the area of the tourniquet, but that can be remedied by using normal techniques to reduce bruising and swelling. The downsides of using BFR. I was unable to find any specific research that presents disparaging information about BFRT. There remain some limitations to its use. BFR can only be used to strengthen the muscles of the extremities and should only be applied to the upper arm and upper leg. Applying the tourniquets near the elbow or knee risks serious damage to superficial nerves in the popliteal and cubital areas. The most common misuse of BFR is found in bodybuilders and those trying to quickly build muscle mass. These misinformed people simply tie bands or straps around their arms and legs and begin lifting to try to chase the pump, which is a feeling achieved following extreme workout. Often the straps are tied too tightly, which leads to numbness and tingling in the extremities as well as blood pooling, which can lead to DVT formation in the limbs. Who can be certified as a BFRT? Becoming certified and using BFRT is open to quite a few medical professions involved with rehabilitation. OTs, CODAs, PTs, PTAs, athletic trainers with certification, chiropractors, and certified hand therapists are all able to become certified in BFRT and begin using this treatment for their patients as well as billing insurance companies for its use. Overall, blood flow restriction therapy can provide an option for therapists to aid their elderly patients in much faster strength and hypertrophy gains when used in conjunction with light load exercises. The use of blood flow restriction will show gains in strength much faster than simple resistive exercises. Because BFR allows patients to see those gains using much less weight to build muscle, it can greatly reduce the torque and stresses placed on the joints when using traditional strengthening exercises. As long as the contraindications and precautions are observed, the use of blood flow restriction therapy with exercise can show greater strength gains and lower extremity MMT scores than by using exercise alone.